Triglycerides are a type of fat found in the body's bloodstream. Initially, these are stored in fat cells and then released into the bloodstream. A high level of triglycerides is called hypertriglyceridemia. A high amount of triglycerides in the blood can lead to many problems. It accumulates, especially in the blood vessels. This increases the risk of heart problems. The best way to lower triglycerides in the blood is through lifestyle, diet, and medication. Let's find out how to reduce these triglycerides today with the suggestions of cardiologist Dr. Malleshwara Rao from Hyderabad. Exercise. Daily physical activity and exercise can reduce triglycerides by up to 30%. Active walking and swimming should be done regularly for 30 to 45 minutes a day. Weight loss. Fat people should lose weight. Research has shown that losing 5 to 10% of your body weight can significantly lower triglyceride levels. If you are overweight, you should reduce the calories in your diet to bring your body weight back to normal. Alcohol and smoking increase triglyceride levels. So quit smoking and quit drinking. People with diabetes should check if there are more of these triglycerides. They must reduce them. To do so, glucose should be effectively controlled. People suffering from high cholesterol need to make small changes in their diet. What fatty foods can people with high triglycerides eat? Do not eat meat with high unhealthy fat content. Prawns, meat, chicken, and deep-fried items are some examples. There are 4 main types of fat in our diets. They are monounsaturated fats, polyunsaturated fats, saturated fats, trans fats. Trans fats are harmful to your body. These should be avoided at any cost. They increase triglyceride levels. They're found in lots of processed and fast foods. Saturated fats are high in animal foods such as meat and chicken. They are not good for your body. No more than 10% of your daily diet should come from saturated fats. So taking these on a daily basis can have a bad effect on triglycerides. Monounsaturated fatty acids and polyunsaturated fatty acids come in the category of good fats. Both omega-3 and omega-6 fatty acids are PUFAs. Monounsaturated fatty acids are plant-based fats found in foods that are liquid at room temperature and solid when chilled. You can find them in nuts, nut butter, oils, olives, avocados, and seeds. It is better to reduce saturated fatty acids and increase intake of monounsaturated fatty acids and polyunsaturated fatty acids. What carbohydrates can people with high triglycerides eat? Reduce the intake of easily digestible carbohydrates called simple sugars. Triglycerides increase with these refined carbohydrates. Therefore, choose fiber-rich, low glycemic index whole foods instead of processed, refined carbs. Sugary foods like table sugar, chocolates, fruit jams, ice cream, cakes, candies, and carbohydrates like white rice and wholemeal flour should be reduced. It is better to avoid cold drinks. You should stop consuming sweet syrups like honey, sugary sweets, ghee, butter, etc., which are rich in fructose. Do not eat food items, pizzas, burgers, or noodles chips in various commercial complexes rich in unhealthy fats and simple sugars. The consumption of millets can reduce triglycerides. Millets are much higher in unsaturated fatty acids, with 2 to 10 times higher levels than refined wheat and milled rice, as well as being much higher than whole grain wheat. Which oil is better to use? When cooking at home, you can use any cooking oil you want, such as sunflower oil, safflower oil, mustard oil, rapeseed oil, or groundnut oil. Even sesame oil and olive oil are beneficial. Make sure to consume not more than 1 to 2 teaspoons of oil in a day. Because essential fatty acids differ, you must use at least 3 different oils. What foods can people with high triglycerides eat to lower their triglyceride levels? Fish. Fish rich in omega-3 fatty acids can lower levels of triglycerides. According to the American Heart Association, eating 2 servings of fatty fish per week, roughly 4 ounces each, reduced triglyceride levels by 11.4%. Furthermore, it increased HDL, good cholesterol, by 4% while slightly increasing LDL, bad cholesterol compared to the control diet. Consume more legumes, soy products, and green leafy vegetables like lettuce, spinach, etc., which can reduce triglycerides. Eating fiber-rich foods is good for reducing triglycerides. Cereals, beans, fruits, vegetables, and pumpkin seeds should be preferred. Including more fiber in your diet can slow the absorption of fat and sugar in your small intestine, helping decrease triglyceride levels. Generally, women should consume at least 21 to 25 grams of total fiber per day, and men should aim for at least 30 to 38 grams per day, depending on age. Flaxseed. Flax seeds contain healthy fats and fiber. The omega-3 fatty acids in flax seeds are called alpha-linolenic acid, ALA. Flaxseed lowers triglycerides. Therefore, if you make a habit of eating flax seeds along with oats, salads, and other snacks, you will get the above benefits. Chia seed. Chia seeds are high in fiber, omega-3 and protein. Chia seeds lead the way in lowering triglycerides. Soak it in water and keep it for an hour. If desired, these can also be included in smoothies and shakes. Garlic. Factors in garlic prevent oxidation of bad cholesterol and reduce cholesterol and triglycerides by up to 15%. Such people should eat 1 clove of garlic and 1 inch of ginger daily. What medicines are needed to reduce high blood triglycerides? Medicines called statins and fenofibrate control triglycerides in the blood. Your doctor may prescribe taking this medicine before going to bed every day. It should be taken in conjunction with a controlled diet, exercise, and lifestyle. If you take food precautions and use medicines, the result is good. Fish oil supplements are also used together with lifestyle changes to reduce the amount of triglycerides. For individuals with hypertriglyceridemia, 4 grams per day of omega-3 fatty acids will reduce triglycerides by more than 30%.